అతి తక్కువ ఖర్చుతో విదేశాలలో MBBS విద్య కేర్ ఆఫ్ విశాల్ ఓవర్సీస్.
Thank you so much, ma'am, giving us the time. I know you're so lot of things are happening in your life. So yeah, please. So as we know about this, robotics is conquering the world in every sphere of life. If we talk about medical, we talk about other things, in corporate area, everywhere. How in medical science it's becoming a boom?
So clearly, surgical procedures have been very critical across the entire treatment and curative realm. When you open up a patient, there is major other risks, there is more recovery time. So science innovated to create laparoscopic surgery. So with that, you put in a small, through 3 pinholes, you would put in the trocar to actually do the surgery. You would put in an optical light. You would have one more. So they created an operating environment without opening, the body entirely. Then through that, because you are using very small holes, the access became slightly restricted. Now, robotic surgery through minimal invasive surgery has been a major revolution where you can get the precision you want. The robotic arm can reach where the human arm cannot. It gives you greater precision, less blood loss, therefore faster recovery and better surgery. And this is something, while it is expensive, the consumables are expensive, it is still giving so much benefit to patients. But like I said, it's very, very important, the person behind the machine. You can buy a fantastic robot, but you cannot have a surgeon and the experience who really makes the difference in the entire treatment. And I especially want to focus on this conference where they're focusing on women's problems. Yes. And many women suffer silently without getting their procedures taken care of. I think Dr. Uma Sinha would be the best one to tell you more about the procedure and the benefit.
And if we talk about robotic surgeries, people have some myths, they get scared. Yeah. What are your things, 3 things you can remove it? I mean, you can just tell the women out there. Yeah.
One, there is no robot that performs the surgery. Okay. It's the woman or the man behind the machine who does the surgery. So that one myth is totally out. Second, people feel robotic surgery takes more time. It doesn't take more time in units like Apollo, where we are completely geared. We have a good team. We have well-oiled operating room. In fact, today, after doing 10 years of robotic surgery, it takes me less time to do the same surgery robotically than it would take me laparoscopically or open. And the third, that is more expensive. Well, if you look at a mobile phone, yes, the smartphone is more expensive than Nokia. But why do you use it? Look at the larger picture. It's not just the bill or the cost that comes on the day of surgery. Look at the recovery of the woman. She goes back to her society, her home, her office within 3 days. She's going to perform in a better way. Or overall, the recovery period of 6 weeks, needing people to help her at home, taking so many medicines, suffering, all goes away in 3 days. That makes a difference, and I think women deserve this technology.
So I think very soon,
let's conclude by saying that this is robot-assisted surgery.
Yes, there's no robot.
Robot-assisted surgery by a skilled surgeon with experience in a good operating room gives the patient faster recovery, less blood loss, and sooner goes back to normal. So patients should come forward when they have the slightest symptom so that through medication or surgery, they can get better.
And ma'am, there is a new member added in your family, like Upasana. Ma'am, just wanted how your life changed after becoming a Masi. You are a Masi, I think.
Yes. So Upasana is a very precious child. She brings joy around her. And by God's grace, she had a baby girl.
Yes.
So Kara is our precious new addition to the family. And just 3 days ago, my son and daughter-in-law had a baby.
Wow.
And so baby Kara also has a cousin close to her.
Wow.
So I think both of them are going to grow up. And the important thing is that they will be brought up to contribute to society in the same tradition that their great-grandfather has given them.
And I just wonder, ma'am, you have seen as a sister Upasana, as an entrepreneur, as a mother, how challenging it's becoming for her. You've been experienced, right? Are you giving some tips to her?
So I often say that there is no challenge that is put forward to us that we don't have the capability to handle. And I'm very confident that Upasana can be a wonderful mother and continue to be an entrepreneur, a social activist, and a wonderful wife, daughter-in-law, niece, daughter. She can handle it all.
So as a Ramcharan sir is doing as a father role, are you on him?
He is super, super proactive. Outstanding father. Hats off to Ramcharan.
So what 3 lines you will say for the women's health from Sangita madam?
So for women's health, I think the biggest thing I would say is please be aware of your health. Early detection, don't neglect yourselves. Of course, diet, exercise, sleep, and relaxation. These 4 you definitely need to stay in the right frame. And the last one I'll say as I'm getting older is to understand that what you did when you're 30 and 40, you can continue to do when you're 60, but you need to support your system. So take the right vitamins, take the right support, and continue to aspire to stay fit. Don't say, I am older, I can't do it. You can do everything, but do it with planning, with care, and with a little bit of scientific help behind you.
1 line for your Upasana ma'am
I love you, Upsi.
and her daughter. She will be your chota baby.
I love you more, Kara.
Okay, thank you ma'am.